All right, now let us look at the esophagus. The esophagus is about 25 centimeter long and it starts at the level of the C6 vertebra, and this place is closely near the cricoid cartilage of the larynx. Then it goes and descends into the superior and the posterior mediastinum, and then it enters the diaphragm, the diaphragmatic hiatus, and then lastly, this approximately happens at the level of the T10, and after that, the entire thing goes and meets the gastrocardiac orifice at about the level of T11. So the abdominal esophagus, the esophagus in general has two curvatures. It's not really like a straight tube. It sort of winds and then it goes and enters the stomach. So the first thing that we have to consider is that there is a midpoint. So let's take thoracic vertebra 5 as the midpoint. The first curvature of the first deviation is leftwards, which takes place near the neck, and this deviation is a little bit towards the left. Then it straightens out at the T5 midpoint, and then there's another deviation approximately below the level of T5 that's near the esophagus. So that's the deviation. There's another deviation there. For the sake of simplicity, let us divide this entire structure into three parts, the entire esophagus into three parts. So the first part is known as the cervical part. Then we have the thoracic region. And lastly, we have the abdominal region. Alright, so now let us take a look on what structures are found here. What are the structures that are found in relation of the entire esophagus? So the cervical part of the esophagus, to be more precise. Anteriorly, we can see that we have this entire structure right here is known as a trachea. And then on the lateral side, we have the laryngeal arteries. So we have the left and the right laryngeal arteries. Okay, starting again. The first structure that we can see on the anterior side is the trachea. Then laterally we have the recurrent laryngeal nerves. The structure in yellow right here, this, and the yellow in right here are known as the left and the right laryngeal nerves. And then posterior laterally we also have posterolaterally, to be more precise, we have the carotid arteries, the left and the right carotid, common carotid arteries. And then posteriormost, we can see that we have the vertebral column and then the longus colli muscle. There's also the presence of the cervical fascia that's not apparent here, but it's important to keep in mind that the cervical fascia is also one of the posterior relation of the esophagus. So that was the cervical part of the esophagus. Let's move on and look towards and look to and observe the thoracic part of the esophagus. The cervical part was relatively more easier as compared to the thoracic part because the thoracic part is in coordination, is in relation with a lot more organs as compared to the cervical part, although it is much more smaller. So as you can see, the first part that we can see that is in close conjunction is the inferior portion of the trachea. And then we have the bifurcation of the trachea known as the left bronchus, the left bronchus right here. Also the right bronchus, but a very small portion of it, but mostly the left bronchus. Then we have the pulmonary trunk, which is this one. And then we have the diaphragm that is also the anterior relation. So all of these relations that what I was speaking about are the anterior relation. Now let's move on to the posterior relations. So now let us take into consideration the posterior relations of the esophagus, especially the thoracic region of the esophagus. We saw the anterior relations earlier, and the posterior relations are much more in number as compared to the anterior relation of the esophagus. So the first relation that we can observe here is known as the longus colli. You can see that some parts of the longus colli also make up for the for the posterior relation of the thoracic esophagus. Then we have the intercostal artery. So the intercostal artery, the posterior intercostal artery is this network right here, and especially towards the right form another posterior relation. Then we have the azygous vein. This blue structure right here is known as the esophagus vein. Then we have the thoracic duct. The green structure right here is the thoracic duct that passes posteriorly. And then lastly, some parts of the hemiesophagus and the accessory esophagus vein. As you can see there, this blue structure right here, I know it's hard to see, but that's the accessory hemiesophagus vein. Also, it is important that we shouldn't forget that there are certain more organs that come into picture here. So the first organ that is approximately located here is the heart, and the pericardia of the heart is in close relation with both the cervical part of the esophagus and also the tracheal part of the thoracic part of the esophagus. Then we have the pleura of the lungs. The pleura of the lungs is mostly in conjunction with the thoracic part of the esophagus. Alrighty, so take a look here and you can see that there are a lot more structures that are more intricate because previously we talked about the structures that are, that included everything. It included the bones, it included the organs, it included the nerves and everything. It was all jumbled. So now let us look at the major great vessels that make up the relation of the thoracic, cervical, and of course the abdominal aorta. So the first thing that we can see here is the heart. And the great vessels, of course, they come off of the heart. So the first relation we can observe is the aortic arch. The aortic arch is in close relation with the lateral portion of the esophagus. And then, especially the cervical esophagus. And then going towards the lateral side more, we can see that here is the subclavian artery. The left lateral subclavian artery. And then we have the thoracic duct too. We can also see that there's a close relation on the anterior, the superior mediastinum to the laryngeal nerves. As you can see that this is the left laryngeal nerve right here, and this is the right laryngeal nerve. And then we have the two vagus, the right vagus nerve, and then we have the left vagus nerve here.